Welcome back, everyone. This is Winnie from Postnatal Kindness. We are back with another talk series today, and today I have a little treat for you. I have with me Miss Kirsy Vera. She's a doula in the Ottawa-Gatineau area, a beautiful mother of a son who's 4 years old. And today she'll be here talking all about doula. If you are like me and you've always hear about doula, but you don't know what they do, you don't know how they can help you, well, today is the day. Miss Kirsy, welcome to our podcast.
Thank you so much, Winnie, for having me. I'm really excited to be here.
It's a pleasure to have you.
Thank you.
Now, just to start with the first question, what is a doula? And how do they help families? For someone maybe who's never heard of doula, or someone who hears about doula but not sure, can you tell us a little bit of what you do?
Yeah, of course. So that's a great question. So what is a doula? So a doula is a support person that is usually hired by a mom, birthing person, or a family throughout labor or fertility journey and for the birth, and then also in the postpartum stages. What does a doula do? It's a lot of both emotional, physical support, educational support. So holding a family through their journey to becoming parents, whatever that may look like. So for people that are, let's say, going through fertility, it might be giving them a bit of guidance on the things that they've tried so far and where to access more resources, maybe showing up with them to appointments, debriefing beforehand or after. If someone is navigating through loss of a pregnancy or a newborn, kind of holding them through that and creating space for others as well to help them.
Yeah.
For a birth doula like myself, it'll be preparing them to cope with labor, regardless of what their birth goals might be, and then also holding space for them in the postpartum. So showing up at their home, providing that postpartum educational support in the home live, which they might not have through other resources.
Right. Fantastic. That's amazing. Now, are you also like a midwife, or is it different?
No, so I do want to make a very clear distinction. So a doula, regardless of what kind, whether it's a fertility doula, a birth or postpartum doula, or even something called a death doula, is not a medical professional in any sense of the word.
Right.
So we are not replacing doctors or OBGYNs or nurses or midwives. It's really just there to serve the mother, serve the birthing person and the family as an added support, but separate from any kind of medical guidance or clinical tasks.
I see. Now, how did you get into this amazing work of being a doula and a support person for mothers? Is it from your own childbirth experience, or how did it come to be?
I think when you're called to something, it comes at you in ways that you don't experience or you didn't anticipate. So I think I was really called to it. It happened for me early in life when I was about 10. My eldest aunt, who is the second mother to me, was pregnant with my little cousin. We're about 10 years apart. And I got to experience her pregnancy through my own eyes as a child. And I remember not just being fascinated with her pregnancy, but also her recent postpartum. I think we showed up in good Latin fashion to her home within 2 days of my little cousin being born. And I got to hold her and I got to help my aunt breastfeed her. And I even got to taste my aunt's breast milk. She put in a little spoon for me.
That's
and
nice,
then after, when she was also bottle feeding her, got to kind of partake in all of that. And it just opened my eyes that I really wanted to be part of that experience. So that's how I got into it.
Fantastic. Now, how does one become a doula? What's the training process? How does it work?
So training process to become a doula. So one, I find usually people are drawn to it. So either you're the bestie that everyone calls because you're a TikTok or Instagram expert, or maybe you've attended a lot of births or have been through a journey that seems to resonate with a lot of people. Usually there's that interest first or that experience. And then if you want to get certified and actually do this in terms of work, there's different certification processes. So just within Canada, Canada, for example, there's Doula School Canada that offer certification both online and in person. There's even certain colleges that will offer doula training or accreditation. Off the top of my head, like Pacific Rim College is one of them that I know of. And then to become certified, there's a educational portion, and there's also a practical portion. So to become, let's say, a certified birth doula, you would have to attend a certain number of births, kind of do a bit of reading with that, and then also provide kind of feedback from your clients that you supported through those births.
I see. That's amazing. Now, what are some of the biggest misconceptions that people have about doulas?
Biggest misconceptions. So one that we will be replacing either your partner or your medical practitioner. So we're not there to, kick your husband or your partner out of the out of the room, or even your mom if someone is attending there with you, or in any aspect of your journey, or that we are medical professionals and that you therefore don't need a doctor, a midwife, an OBGYN, a fertility clinic. That's not what we do. Everyone has a role to play, and ours is very distinct, and it's very much for that mama, for that birthing person.
Right. That's amazing. Can you walk me through, let's say, a patient or maybe like a couple, from a prenatal to during birth to maybe postpartum? Like, what is like a scenario for you, when you walk them through, and how do you prepare them and how do you support them through that whole transition?
Okay. To kind of encompass it and maybe appeal to the masses. So for my own experience, for example, it took me a while to get pregnant, even though I was fairly young. So someone that maybe resonates with that would reach out to me maybe during their fertility journey, maybe needing a bit of extra assistance. And support, either going to appointments or debriefing set appointments with their fertility clinic as they're going through IVF or IUI. Until they eventually get pregnant. Once they are pregnant, can be a lot of anxiety, a lot of feelings through that. And you can't always talk to your doctor or your best friend or your sister, your aunt, because not everyone will be able to relate or hold space for you without bombarding you with information. So you're pregnant, now what? You got your doula. Your doula then follows you through your pregnancy. Make sure that you are asking the right questions to your provider. So if you do have anxieties, concerns, that you can echo that back to your team and that they can guide you as necessary or as appropriate for your medical circumstance. And then they prepare you as well. So I would prepare you for what's to come in pregnancy, things that you can expect, what is within the range of normal. And usually I develop a good rapport with my clients. So if something doesn't seem right or just not sitting well with their intuition, I would always encourage them to get that checked out. With the preparation of labor, I would go in person to their homes. I would offer prenatal visits. I usually do one that's a bit more sit down, casual, conversational, where we dive into the physiology of birth. So what actually happens and different comfort measures, what they can expect in a hospital setting, in a birth center setting, or even at home, different pain options, etc. Just so that they really understand from A to Z what is happening in their body and what is going to be happening in a medical setting. And then the second appointment that I usually do is more hands-on. So I don't want to just bombard you with the information. I want you to also practice. I'm a big advocate of practicing for the birth that you would like to experience, even if it's just practicing within your mindset. So concentrating on being masters of your own mind, especially when emotions and sensations and overall there's a bit of overwhelm. I want you to practice mastering yourself, kind of finding your focus. And with partners or whoever's going to be part of your birth journey, I would also have them practice on you and together different comfort measures. So how can we physically support you? How can we create a space where you feel safe, where you feel comfortable to give birth, and where your body then resonates with that message and is able to do what it needs to do. And then typically I would follow families once they're in their labor, active birth, whether that means at home in a birth center or at the hospital. most people will be in a hospital setting. So either I see them in early labor at home just to make sure that we're in the right headspace, that we've done all the things that we can do to help mom feel comfortable and safe and help the labor kind of progress as much as we can.
Yeah.
And then once we're in the hospital, I kind of let the team take over in the sense of this is now the plan, this is how they can help you. But still giving you that framework of, you know, what's happening, you're in charge. And I kind of echo back and forth what information is being presented to mom, birthing person, and the family so that everyone's on the same page. So it doesn't seem like a mystery and that the birthing person or mom is an active participant in the birth, and not just that it's happening to her, but that she has agency throughout it all. So that's up until the birth. After, within the first few hours of birth, I usually stay to make sure that she's able to have skin to skin. If there's procedures or complications, that there's someone present for mom and or baby, just depending on what their preferences are. And that I also facilitate breastfeeding or bottle feeding. And I essentially want to leave them settled and grounded. And basically, I want to tuck them into bed so that they can rest for whatever's next. And in a postpartum setting, as a doula, I show up to people's homes, depending on when they feel they need the service. So whether it's within that first week, within the first 2 weeks, and I support them with baby care, with education around everything baby, from feeding to bathing to burping to swaddling and sleep, and also education for moms. So things that are happening within her own body, hormonal changes, breastfeeding, how to do that, how to bottle feed properly, how to rest, maybe ideal things to be eating or not eating, drinking, and also checking in with a support person or with the overall family to see how they're going or how they're experiencing everything and how we can then support mom best.
Wow, that's amazing. I think I needed a doula when I gave birth.
We all do. We
do, definitely. Now, when it comes to postpartum moments, and we all know how that can be a little challenging for families and for the mom and for the dads as well. How do you approach that with sort of like education? And, you know, as you mentioned, you also do education before. So, you know, you tell them what to expect, what's going to happen. What is the response, you know, especially from fathers, you know, about all of that and seeing them in action during postpartum? You know, how do you, you know, practically assist them?
So what do I do to kind of assist fathers, and in terms of postpartum, what that may look like as a doula? So the first portion, again, goes back to the practice and the preparation that I do prenatally with the family. I think when you understand what can happen and what will happen in terms of sleep deprivation or what breastfeeding is really like or bottle feeding babies and what they do, you know, how often do they cry or what sleep looks like, it then changes the perspective of how do we prepare. A lot of the partners, especially men, want to be involved, want to help, and they approach it from a very practical, pragmatic sense. So giving everybody a job helps, and also giving them things to look out for, especially for first-time parents. If both haven't experienced a pregnancy or a birth or a postpartum, I like to be very honest and transparent. So, for example, usually after my birth client has their baby, I will text dad and say, hey, I know we talked about it already. I know you guys are doing great, but I just want to remind you that on day 3, there's a huge shift in terms of hormones. There's a big hormonal crash. It's the biggest change, hormonally speaking, that a person will ever experience. So forget menopause. That's also a big one. But day 3 postpartum is a big one. And these are things that I want you to be looking out for, that mom might be experiencing for reasons that you may not know or she may not be able to vocalize for you. But this is how you should respond. And if things seem to drag, so for example, certain behaviors that are not common to her seem to kind of last a bit longer than the 1 or 2 week window after postpartum, here's what I want you to do about it. So giving them a plan, both prenatally and then postpartum, of here's what you should look out for. Here's how you can respond. I find that gives, especially fathers, a lot of peace of mind, right? Because they want to be involved, they want to help, they want to love on their woman, on their wife, on the mama of their baby to the best of their capacity, but sometimes they just don't know how
to. That's fantastic. That's amazing. Now, when you are a woman is in labor and you are helping her, and it gets intense, and all those emotions and everything that's happening, how do you stay grounded? How do you sort of keep your calm despite whatever is happening, to be able to help the mom better?
So I think it's two things. The first one is I really try to stay mindful that her experience or what I'm experiencing right now isn't mine.
Okay.
So I might have my own lived experience, whether it's positive or negative. I'm trying to stay as neutral as I can, still coming from a place of compassion and empathy. And obviously I'm informed by my own experiences, but I don't want that to overshadow what she's living.
Right.
So just because I had back labor doesn't mean that she's having back labor. So just constantly checking my own bias and making sure that I'm a pillar of support and I'm grounded, so that then she can lean on me, whatever she may be experiencing. Compartmentalization really helps with that. I've had quite a bit of practice in that regard. But yes, making sure that I kind of distinguish myself and my lived experiences from what's going on. And I'm really just there to be a place of solace for her. And the only way I can do that is by staying calm and echoing that calmness. And I think the more births that you see, they're all very different, and you'll never see,
I can imagine,
you'll never see two births alike, but understanding that there's a normal process, and really kind of holding on to that sometimes. Yes, I know this is so difficult, but you're doing it. You've done it this far. You're almost there.
You're almost there.
Sometimes I say that, and it's really to just reassure myself. Because it can get really intense.
I can imagine,
distinguish myself from their experience, but then also taking care of myself. So that often will look like, instead of just picking up the phone where I'm having a contraction, Kirsy, yes, you are. I'm going to go back to sleep, right? If I can sleep an extra hour, that will help me, right? If I can eat and shower before I get ready to support a mom in labor, that will also center me.
Right.
And then knowing that there's an end to it, right? It's not going to be this intense that much longer.
Yeah. Fantastic. Now, since you're at the hospital with mothers, and there's a whole medical team around, nurses, doctors, and everybody else, how do you sort of work together as a team?
Okay.
For lack of better words, are doulas, welcomed in the medical setup that can be, very well structured and stuff. Are you, welcomed? Are you part of the team? How does it work?
That's a good question. So, are we welcomed in the medical setting? Are we welcomed by OBs? Are we welcomed by midwives, nurses? Yes.
That was a far yes.
If I want to remain optimistic, yes. There's a space for us.
Yes.
I think we're getting better. There's improvements already in place.
Right.
And I'm hopeful for more progress. But I think a lot of it comes from a misunderstanding of our role. So both in general what society thinks, and then even in the medical aspect of it, we're not there to replace the doctor.
No.
I'm not double checking his work, right? I don't know what he's doing. There's certain things that I might witness or see that I might want to echo to the family.
Right.
For example, if I'm taking pictures, if I'm recording a video and I can see doctor is pulling out something to perform an episiotomy on mom, I'm not telling him how to do it. No. I might echo to my client, hey, I noticed that doctor is getting ready. Doctor, did you want to explain what's going on right now for mom?
I see.
And with that, because we're there, no, we're not employed by the hospital. The hospital's not paying us, or the birth center or the midwives are not paying us. Really, our client is the birthing person, is that family. So we're there to serve them.
Right.
from that perspective,
Yeah.
it does mean that we sometimes will challenge, not necessarily the practitioners, but we will challenge the status quo simply by being there.
To be there, yeah.
And depending on the midwife, the nurse, or the OBGYN, they might already have their own experiences and are already not meeting us maybe with an open mind. But we are there to make sure that mom, again, is an active participant in what's going on, that things are not just being done to her because it has to be done to her, but that she understands why and that she's consenting to it.
Yeah.
And I think that should be the very foundation of medical care.
Yeah.
Especially when something happening to women and in an obstetric sense. We can't just remove agency from women. We have to make sure that it's their choice.
It's their choice.
All throughout.
Yeah. Wonderful. Amazing. Have you ever had a case where, you really had to advocate for a mom in a critical moment at the hospital during, a rough childbirth?
So so far in my experience, rough childbirth, maybe no, not when things were, lights and sirens or emergencies, but just in little moments. Sometimes, obviously, nurses, doctors, midwives, they come at birth and labor from a risk assessment analysis point of view. Me as a doula, I don't have that lens. So I have to understand and relate where they're coming from.
Yeah.
But I also want to make sure that my client is experiencing what she's hoping within a certain, realm of possibility, and that she's participating and understanding what's going on, because I know that will help her after. What I often have to when I have to speak up is more so in the afterbirth.
Right.
So a lot of people might not know that once the baby's out, there's still a few things that need to happen.
Yes,
especially if you're having, let's say, a vaginal birth. Vaginal birth, baby is born, placenta needs to be born as well. And with that, there's a cascade of interventions, especially in a hospital setting. There's what we call like a fundal massage. People are looking at baby, cutting the cord. There's a lot of little things that are big that are happening simultaneously. But then I look at mom and see how she's coping. At that stage, usually there's going to be some severe shakes, right? With all the adrenaline coursing through you. So you're shaking. You're kind of in the nude. You're vulnerable. Your legs are open wide, depending on what position that you're in. You have someone pressing on your belly, usually a nurse. That's very painful. It's very uncomfortable. And now you're holding this baby that you've been really wanting to meet for a long time, but it's a lot. Right? Someone's taking pictures of you. Your spouse might be kissing you. And what about mom? So I always look to her, see how she's coping. And sometimes, even though hospital policy, for the most part, says, golden hour, 1 hour of skin to skin, I look at mom and see, is she coping right now? And I've had to speak up lately where saying, Mom, are you doing okay? Do you want me to pass baby to dad? Or mom or whoever else is there, because I think you might need some help to just focus on what's going on, kind of getting through this, and then baby's going to be right back on you. And I've had some pushback, like, no, skin to skin needs to happen. I'm like, yeah, but mom needs to be able to cope. Right? That baby is a few centimeters away with dad, with mom, with whoever else is there, getting that skin to skin. But I need to make sure she's okay in this moment. And that can that can create a bit of friction, for sure. For sure, but that's what I'm there for. Right? Kind of creating that space.
We all need a Kirsy during childbirth. We all need a doula. Now, just two last questions. Let's say, someone who is pregnant or is looking for, that kind of support, like a doula. Like, are the prices, do they have to sell a kidney, or is it like sort of affordable? Just kidding.
That's a really good question. I think everything is a question of perspective as well. So the birth doulas, for example, will usually cost you a lump sum, whereas with postpartum doulas, or even, fertility doulas, birth doulas will cost you a lump sum. I would say the range within the Ottawa-Gatineau region is anywhere from $800 to less than $3,000, depending on what the package looks like.
That's good. So you can keep your kidney?
You can definitely keep a kidney. You can stay intact. And I think, obviously, there's a dollar amount, especially with the economy the way it is. I think it's a worthwhile investment. It's an investment in the mom, the birthing person. It's investment in the family and the family that you're creating. Especially if the journey to parenthood has been a bit challenging, you need someone on your side that's really just there for you, not to overwhelm you. And then in terms of postpartum support, there's usually hourly rates, whether it's for daytime or for overnight, and that's a bit more customizable.
Right.
It just depends on what the family needs. So, for example, if you have twins or triplets, maybe you need a lot more help.
Yeah,
You need a lot more muscle.
Yeah.
So that requires more hours, so therefore more expensive. Maybe you just want someone to check in on you for the first 40 days.
40 days.
Right? Especially in certain cultures or traditions. East Asians, even Latinos, for example, we have what we call la cuarentena. So the 40 days where you're home. You need support for that, right? So yeah, I would say birth and postpartum is doable if you plan accordingly.
Fantastic. Now, just, as a last question, and you mentioned how you care for yourself, because it can be, hard on you mentally and emotionally and physically. How do you carry these experiences without burning out or taking them home with you?
So how do I cope with being a doula, and how do I not take them back home with me? So the reality is that I'm also human, right? So yes, 100%. I'm trying to check my own bias and lived experiences at the door to not let it bleed into your own. But I'm also sharing that experience with you. And as a human, I also give myself permission to feel it, right? So especially oftentimes I'm taking pictures and videos and I'm seeing babies be born and I'm seeing moms and dads react and both in the positive and sometimes in the difficult times, I share that with you. And I think there's something beautiful to be able to have a support person that can get there with you. Obviously, I try to keep myself in check because, again, I don't want to overwhelm or bleed into the experience, but if I need to cry a little bit, I'll let myself cry. Good right? There's a beautiful baby joining us, and I've seen the weeks and months that it took to get there. So I'm so proud of my parents, proud of my mamas. So yeah, a little tear here and there doesn't hurt nobody. And then in the more difficult times, it's having my own doulas, my own doulas that I go to. So whether they're actually in the birth or postpartum or fertility world, I have friends that I can connect with and debrief on the births that I had or the postpartum. Sometimes it looks like a quick text, like, "Oh my gosh, I had such a hard time. I didn't feel like I did a good job." Or, but again, just having that pillar of I know where I can go if I need the help, when I need the help, or even before I think I need the help. And then also therapy. Therapy really helps. Just because sometimes, more so for me personally, I'm great at compartmentalizing and maybe pushing certain things aside. And I wonder why I feel a certain way and it's hard for me to connect the dots. So therapy has been really helpful on an ongoing basis to make sure that emotionally I'm, balanced and stable and can then show up fully for people. And then I guess the last portion of it is, how do I not take it home with me? I have to pace myself. So between births and postpartum or fertility journeys, there's only so much capacity that I have mentally, physically, and I have to honor that. And it's hard to say no sometimes, especially as a woman, especially as a Latina, where, I show up. That's what I'm there for. But I can only show up 100% if I first do that for myself. 100%, so I'm learning. We're only 30. So that's coming into practice more and more. But I'm excited to see what that continues to evolve and look like.
Wonderful. Wow, that's amazing. Kirsy, I want to thank you. I want to thank you so much for giving us the time to come to Postnatal Kindness, and for telling us about what you do as a doula and how we can benefit from the doula services. Really appreciate it.
Thank you so much, Winnie. I feel so grateful to be here for the space that you've created for me to share. As well, a big thank you to you for all the things that you're doing, how you're showing up for families and for these mamas in the Ottawa Gatineau community. So if you need extra help, guys, please don't hesitate. Give Winnie a call.
Thank you. And call Kirsy if you're about to give birth. Take care.
Thank you.
See you soon.